Greetings! My name is Soozcat. I run the blog Confessions of a Laundry Faerie, which can be found at laundryfaerie.blogspot.com. And today marks the 18th week after my duodenal switch surgery, which took place August 2nd, 2018. It's getting to be Christmas time around here. We do celebrate Christmas in this household, so it's been kind of insane, which is one of the reasons why I didn't do a video last week. The other is that I simply forgot and just can be scatterbrained, and I just forgot. So there you go. However, there are some things that I do want to talk about this week. Some interesting things happened. One of the big things that happened yesterday was that I went in to see my ARNP for the first round of tests, blood work, etc., after surgery to see whether or not I'm getting sufficient supplementation. This is really important. I mean, I can't stress it enough. If you don't do it, one of the potential serious side effects of DS surgery, if you don't get in the right amount of vitamins and supplements for you, you can end up in the hospital with problems having to do with malnourishment. You can end up dead. There's all kinds of fun things that can happen. You don't want to have these things happen. So it's really important when you have information from your ARNP, your surgeon, or your nutritionist about what kinds of supplements you should be taking. You need to take them, first of all, but you also need to make sure that you are going in to have regular tests done so that they can see how well that supplementation is working. You may be taking too much, you may be taking too little. They're going to have to adjust. So they want you to do these baseline tests and see what's happening. So I came in yesterday so that they could go over the results of my tests. My ARNP was very pleased, and I was very pleased too. Before the surgery, my A1C ratings, which tells you the amount of the level of your blood sugar over about a 3-month period, my A1C ratings were at about 10. Just so you know, 5 is normal. So they were extremely high and not unusual for a diabetic. The last time they tested, yesterday they took a look, and the A1Cs over the last 3 months have averaged 6.1, so almost normal. We're not quite to normal yet, and frankly, there have been some times when I've eaten some things that I shouldn't have, as I think most of us have at one time or another. So what this tells me is that if I continue to eat right, I should have normalized blood sugars pretty soon. And I'm excited about that, because that was the whole reason why I did this surgery. The weight loss is great, but the real reason why I did this surgery was to try to stave off the serious effects of type 2 diabetes. So we'll see how things go there. They are going in a good direction. The only thing that my ARNP wanted me to change is she wants me to take one more iron supplement every day, because I'm a little bit low on iron. I can live with that. I'm good. One of the things that you are going to have to do, and it's one of the things that I hate to do, is go in for blood draws for a lot of these tests. I hate going in for blood draws for a number of reasons, but the big one is that I'm a hard stick. They will inevitably try 3 or 4 times to get a good vein so that they can get enough blood out of me. And as a result, I have developed a little bit of a phobia about blood draws. I really, really dislike them. And if you're like me, you probably try to avoid blood draws as much as possible. So I thought I might pass on some of the things that I have learned over time, just from personal experience and also from talking to some of the technicians who do blood draws, about ways to make that a little bit easier. One of them, when I forgot this time, because I also had to do a urine collect, which is always fun. If you can help it, don't go in dehydrated. If you have a tendency toward dehydration already, like I do, the day before you know you're going to go in and get the blood draw, drink as much as you can. Get things as plumped up as possible, because it makes it a whole lot easier to get blood out of you. The other thing you want to do, if you're going in and you know you're going in, you have a little bit of time, if you can take some kind of pain reliever. If you're only within the first 6 weeks of your surgery, you're going to want to take something like Tylenol, which is not going to interfere with your stomach. But if your stomach is healed up, you can take aspirin or ibuprofen or something similar. You'll want to take that maybe an hour or two before you go in, if you can, because that will help the actual blood draw be a little less painful. What else? If you are a hard stick and you find that they can't get anything out of the crook of that arm, it's just not working, you might want to consider having them take it out of the back of your hand. Yes, it hurts. It hurts a lot more than it hurts in the crook of your arm. But one of the advantages to the back of your hand is that veins are very clearly visible, they're accessible. Sometimes they will get enough blood out of those to do the work that needs to be done. So you might as well consider it, because there's a good chance you won't have to be stuck as many times if that's the route you take. Another thing you might want to do, if you're a really hard stick and you know that it's not going to go well, ask for a phlebotomist. That's really what phlebotomists specialize in. It's what they do all day. Even better if you can find a pediatric phlebotomist whose job it is to get blood draws from little kids with little teeny veins. If you can swing that, that's probably going to be your best bet. Not everybody has a phlebotomist, let alone a pediatric phlebotomist, but if you are going to a hospital to get these tests done, there's a good chance that somebody will be on call who can do that. And it's worth it. Just because it means that you're not going to be stuck 4, 5, 6 times and start freaking out about it. If the sight of blood bothers you, it doesn't really bother me. My problem is I can't think too hard about needles in veins because it freaks me out. But if the sight of blood does bother you, quite often you have to go in fasting for these things. And the combination of feeling faint at the sight of blood and fasting sometimes makes you woozy enough that you might faint. So it's probably worth reminding you, if the sight of blood bothers you, look away. Just find something else to focus on for a little while. Because if you spend a lot of time, well, hi Roxy. We might say Roxy in this video, you never know. If you spend any amount of time staring at your own blood being collected, there's a good chance you'll get woozy, you might faint, you might barf. These are not things you want to do. So find something else to focus on while they're doing the actual draw. That's worked pretty well for me. And it might even work for Roxy, who knows? Roxy. Now she's loving up the camera. This cat's weird. Oh well. Some other things that have happened that don't have to do with labs. I'm losing my hair. Makes me sad. They warned me this was going to happen, and they should warn you that this is going to happen around the 4 or 5 month mark after your surgery. It takes about that much time for your hair to sort of catch up to things that are going on. This is something that is referred to as telogen effluvium, which is just a fancy way of saying your body is reacting to a traumatic experience by dropping a whole bunch of hair and then not growing it back right away. The good news is that your hair will grow back. At least this is what my surgeon is telling me is going to happen. We'll see if he's telling me the truth. I used to have an absolute mane of hair, and that's gone away over the years. But I don't feel like I have a whole lot more to lose, so I'm hoping that will work out. Some of the things that they tell you you can do to try to minimize hair loss, although you'll probably still have some, is to supplement by taking biotin. I take a total of 10 milligrams of biotin every day, 2 5-milligram capsules. And my nails have never been healthier, but I still am losing my hair. So that's a possibility. Zinc is also a possibility. You'll want to talk to your surgeon about how much zinc you should be supplementing with, or whether or not your surgeon recommends it. But I've been taking biotin, and that may have slowed it a little bit, but it hasn't actually stopped it. So be aware of the fact that you are going to lose some hair around the 4 or 5 month mark, and that everybody's telling me that it will grow back. So I'm hoping they're telling me the truth, but we'll see. The other thing that I've noticed since I'm here in the Northern Hemisphere and it's December and it's the Pacific Northwest and it gets freakishly cold with the humidity around here, I'm really feeling the cold. I don't notice a lot of other changes going on right now, but I know that I've lost some significant weight because for the first time in decades, I am really feeling cold. That's not really ever been a problem for me as an adult. So I'm bundling up a lot more than usual, and I recommend that if you're in a cold climate, you do the same. Stay healthy over the end of your holidays if you can. I think that's probably going to cover it for this week. So I'm ready to sign off. Again, my name is Soozcat. I run the blog Confessions of a Laundry Faerie, which can be found at laundryfaerie.blogspot.com. As always, if you have questions, if you have comments, or you would like to give advice, especially advice about losing your hair, please make comments below. I'd be happy to respond to them. I hope you're having a fantastic week and that the end of your holidays are treating you right. Hoping that the new year will be a good one for you. I don't know if I'm going to be doing another video through the end of the year. We'll see how things go and whether I have anything of interest to tell you. Anyway, that's all for this week. Thanks for your time. Bye.